Hi guys, I'm Dr. Dawson, and today I want us to talk about one of the slightly awkward issues that comes up pretty frequently in my office, and that's gynecomastia, or more specifically, why is my teenage boy all of a sudden beginning to grow breast buds? So before I get into this, I want a little disclaimer that while what you hear in this video will be pretty much true, it may not be a 100% scientifically true, and I may use a little bit of poetic license. I think you'll find this happens a lot in medicine when you ask a question, because almost any question you ask would take about 4 hours to adequately explain in scientific fashion, but frequently a little poetic license, we can take a few shortcuts and get a pretty good answer in a shorter period of time. So the issue is, why is my teenage son all of a sudden getting, breast tissue? This comes at a really bad time. This is when teenage children are exceptionally introspective. They're looking at themselves and seeing how they're different from others and really wishing that they were the same as everybody else. And so this is a bad time for a little teenage boy to start developing breast. But the situation is that this is exceedingly common. And when a doctor says something's common, that means it's common in our office. That means that probably most of your buddies are not going to be dealing with this, but it's still pretty common in my office. It's called gynecomastia. And this is something, it does not mean that you're more feminine or that you're not, macho enough or not making enough testosterone. In fact, the way I explain it, I tell guys that it's really because they're more macho that this is happening to them, and I'll get into that a little bit later. The other thing to keep in mind is this is temporary. Once again, when a doctor says temporary, doesn't always mean the same to me. I'm a lot older than you, and so saying something may go on for a couple of years seems temporary to me, but if you're 12 years old, a couple of years can be a really long time. So what's going on? How come this is occurring? Well, the answer is that estrogen will cause breast tissue to grow in both boys and girls. And we both have the tissue, as we've mentioned. And I think the best example of this is going to be when a 2-week-old baby comes into my office for their 2-week visit. Half of those babies, while I'm examining them, will have a little breast tissue underneath their nipples. And this is just from mom's estrogen being in their system. And I can feel sometimes a pea-sized mass, sometimes it'll be as big as a golf ball. And if you press on it, which I don't really recommend that you do, but sometimes maybe a third of the time, a little bit of milk will actually come out. And so when a new dad sees his little boy producing milk in the office, that's not always a happy dad. But that's just the way it is. This is mom's estrogen going into the baby's body through the placenta, and it's causing the breast tissue to grow. And it's totally normal. It'll go away in that situation sometimes in a few weeks, or a few months, and that will be fine. But as we said, anytime breast tissue is exposed to estrogen, the breast tissue will grow. So why is that happening to my teenage son who's in middle school, and why did I say that maybe this is a sign that not that he's more feminine, but that he actually may be more macho? And this is the answer to that. When testosterone is being formed, I think the best way to think of it, I like to think of it as an assembly line. And you start with chemical A and you convert it to chemical B, and that converts to chemical C, which then is converted into testosterone. And when you have some of these guys, they're producing their testicles are starting to make the testosterone, and they are, cranking it out as fast as they can, and they're making a bunch of A, turn it to B, turn it to C, and then ultimately to the testosterone. They make so much C that it's actually overflows into the blood system a little bit. And when it gets in your bloodstream, there's other parts of the body that can sometimes convert that C into estrogen. And so all of a sudden, these boys, while they're cranking out the testosterone, also are making a little bit of estrogen. And that estrogen, when it gets to the breast tissue, will make the breast tissue expand. And so does this mean that you're gonna have to go out and get them a bra? No, it does not. Does it mean that this area may be a little bit tender? Yes, whenever any breast tissue is growing, the area will be particularly tender. So if you get hit in that area when you're playing football or whatever, it is very likely to hurt. Some people, and you will see things that say that smoking marijuana makes gynecomastia a little bit more likely. While this may be scientifically true, I can't say that in my practice that I've seen that to be a huge factor, but parents like me to mention it, so there you go. And what can your son do about the gynecomastia? Well, he could encourage all of his friends to watch this video, would be a start. But more likely, most guys may just want to wear their t-shirt when they go swimming for the next couple of years and just wait for it to fade away. So that's how gynecomastia works. Just a little too much C floating around in their bloodstream after maybe sometimes up to a couple of years, then their body kind of gets caught up and starts cranking out more of the testosterone, and the C levels come down in your bloodstream, and the gynecomastia just fades away. Certainly it's something that the next time you see your doctor, it'd be worth pointing out to him. If you were having more significant symptoms, certainly if they were, extremely tender, if the mass was somewhere besides under the nipple, if there was bleeding or anything abnormal, you'd want to bring it to your doctor's attention sooner. So that's gynecomastia. That's why those boys tend to be the macho ones that are making testosterone as fast as they can, and it is temporary and it'll go away. So I hope that helps.